And it's time for Pet Perspective with Dr. Norman. You know, okay, here's a scenario. I know we've been here. It's the middle of the night and suddenly your pet starts acting sick or injured. As pet owners, this is incredibly stressful because our animals cannot tell us what's wrong. So the question is, how do we know when this is something that can just wait until the next morning, or if it's actually an emergency and we should attend to it right then and there? So that's why I have Dr. Jennifer Norman with us from the Ada Animal Hospital, along with her two lovely pets. We got Ralph and Charlie. And we're going to discuss some of the biggest signs that pet owners should never ignore.
Yes.
Right?
Yes.
Okay.
Because it is. It's stressful. They can't talk to us. So what do you do in the middle of the night? So the big ones I always say, they should be obvious, but not always. But if there's any bleeding or known trauma, you know, they fall, they get into something, they're bleeding, get them seen right away.
All right.
You know, we never know how severe that's going to be. And then if they're having any difficulty breathing, and not just like a little pug here with his normal difficulty.
Yes, so something that you hear all the time. You know that they're okay, they're not distressed.
Yes.
But what are the signs of distress breathing?
The signs of distress breathing are if it seems like all they can concentrate on is breathing. Okay. So you're trying to call them up, do something else, and they're just standing there and all they can do is breathing. Or if they're sleeping, but suddenly their breathing rate is a lot more rapid. It's really shallow.
And they're not dreaming?
They're not dreaming, no, no, but they're just, that little chest is going up and down, up and down. And again, they're not dreaming, or they're just laying there and they don't really have the energy to do anything else. Those really just short, gaspy breaths. Yes. That's when get them in the car. I know it's 1 a.m. Get them in the car, get to the ER and get them assessed. Okay, all right. So distress breathing, like true distress, not like when you watch your dog sleep and they start kicking and they start breathing fast, and because they're dreaming in that state. Yes.
We're talking your dog is sleeping, it looks completely fine, but aside from that, the breathing though is rapid. That is distress breathing.
Yes.
Okay, all right. What type of situation can we wait until morning? Now, I know you had mentioned if there's like an actual injury, if there's bleeding. What if it's like minor bleeding? You know, like a scratch or something?
If it's a scratch and you can find where it is and you can apply a little bit of pressure and it stops, that's fine to wait. If they're not acting in distress about it, that's fine to wait. If they're limping a little bit, you know, and they're not, again, crying in pain, they're holding maybe a leg up, but they're still taking treats, they're wagging their tail, you can feel everything on them, they're letting you touch things. If you want to wait till the morning, give your vet a call first thing in the morning, rather than rushing out at 1 a.m. That's typically fine for them. Okay, all right. So again, assess kind of their overall demeanor. Like, are they eating? Are they playful like Ralphie? Yes.
Do they want your attention?
Do they want attention? Do they want to do things? Are they their normal personality? You know, that's always what to assess too. Okay. Kind of the same with the eating, because some dogs don't really want to eat all the time. So sometimes, you know, maybe they don't always take treats, but they're otherwise acting okay, then that's fine. Okay. Little Ralph here, if he misses one meal, there's something wrong with him. And if your dog is one of those, then maybe getting him seen again. In the morning, maybe not 1 a.m., but getting him taken in.
And Dr. Norman, you raised such an important point here, I think, for our pet owners out there. You know your pet, right? You know your pet's demeanor. You know their behaviors and their attitude and how they typically are. So on the flip side, if you're not noticing anything beside the fact that they're acting off, that they're lethargic, that they're just kind of out of it, would you say first thing in the morning, or just go on your gut instinct?
Go on your gut instinct. You know your fur babies, you know them, and if your gut is there is something really wrong, getting them assessed, getting them to a facility that can at least triage, get that good once over is always a good idea.
Yes. And Dr. Norman, where do people go so they can access you when they need you?
So our website, idaho-today.com, or give us a call at 208-362-5329. We actually partner with an after-hours triage service, so you can call our number, talk to a real person with veterinary experience to help you figure out, do I need to go to the ER right now, or can I wait until the morning?
Wonderful. So even if you're still on the fence, you get some professional guidance.
That's exactly.
Thank you so much, Dr. Norman. Thank you, Ralphie, and thank you, Charlie. Everyone, will see you back here tomorrow at 12:30 for Idaho Today. You take care. Bye-bye.